So we started thinking about it. Could be psychological. Could this patient have something? So I actually gave up, and I put the lead down for the leg. So I put the lead for the leg, and I started doing. She said, wow, yeah, I feel it. I said, okay. So she feel it in one place, so I don't know what's happened in the other place. So she felt in the leg. So I already had the thoracic one. I didn't took it out. I left it there. We went to recovery room. As soon as she sat up in recovery room, she felt the back. It was amazing. She felt nothing there, nothing, not even a little bit. And then after she did. So the trial went very successful. This is a patient that the pain was so severe that once she was flying from London to New York City, the pain became so severe after the plane had takeoff, the plane has to come back. The plane returned because she was screaming, excruciating pain at the plane. And the plane has to come back to take her to the hospital, and she flew the next day or whatever. I don't remember. But she told me about this very interesting experience she had, and she was so embarrassed that the plane has to return because of her. And she had implanted. This is a patient that I hear about her maybe every 3 years or 4 years. No meds whatsoever. She had to try all the meds. She hated the meds. And she has been implanted since then. It was in 2005. And here and there, I hear from her telling me how good she is. And once I just had her to change the battery. Just this. So this is a typical example how really long-term cost effectiveness happens. This is a patient that doesn't really cost to the health system. She's out there with her implant, doing fine, being happy. And that's all you want to hear from patients. Yes, there'll be some patients we can shoot, drive you crazy. But in general, most of my stimulator patients, my implant patients, they do well. You hear from them only when they have some problems or some real complications. Otherwise, they don't really input too much on the healthcare system, what makes the cost effectiveness really a real thing. So any questions?
Is there ever an instance where you wouldn't put in 2 octaves? Or is it always a good idea to always put in 2 octaves versus quads?
Quads. In terms of cost, it makes no difference. Right. So the leads cost pretty much the same money. In terms of working or doing, it also makes no difference. The only reason that we still using quads today is because, let's see, I have a perfect example. I want to use one battery. The battery has on capacity to 8 to 16 electrodes. So I had a patient that I want to use one battery, and I want to have 2 leads on the back and 2 leads peripheral. So in that case, I use quads. But if I don't have that situation, I always use octaves, okay? Because it's the same thing. I don't save anything, and I should have some options there to work on them, okay? Any other questions? Everybody's...
different pulse generator and given by Medtronic and given by
ANS, Judy, San Judy, yeah.
And what's the difference from?
Okay. This is a very difficult question because nobody has done. I think it's unethical to do trials to see if one is going to be better than other. Each one of them present with their advantage. My experience is that I felt that with some of them, like St. Jude has some kind of specific leads that I like better for certain kind of patients. I has a feeling, this is just a feeling, this is a clinical experience. I like the ANS, they say they use different kind of pulse generations. One use pulse frequency, and the other one, oh guys help me out, is the way they have current, yeah, constant current and constant frequency. So with the constant currents, they said the pulsation is different. So the patient will feel the pulsation different. Truly honest, I don't believe that it's really major difference on that. But some patients felt, especially RSD patients, they feel better. I had 2 or 3 patients that had the 2 different generators, and they told me that the ANS, the St. Jude, is a little smoother. The way they feel it is a little smoother. With RSD patients, it seems they can tolerate it better. Is it true? I don't know. So I have options. They have different options. There are other things that I consider is the availability of the rep, the logistics. I have consistency when my patient needs help and they're going to find it. Both of them are pretty much very well established today all over the world. I make decision. The patient has an intrathecal pump that's Medtronic. I'm not going to use two companies. I use Stimulators Medtronic. So it'll be easier for them working with one rep only. So I look those logistics. There is another one that I do not use it. It's just because it makes it too complicated. Having three reps is like having three husbands. So involved a few. So I already married two. It's already complicated enough. But it actually, what we do is like, there is the bionics. So the bionics only have, the generator is only rechargeable. What I don't like for a lot of my patients. It's very interesting about this rechargeable thing, because before we didn't have a rechargeable available, and we always dream about a rechargeable, because it'd be great, you're not going to have to remove and change your battery. Then what I found out is that there's a lot of issues with recharging, and sometimes the patient doesn't recharge completely the battery, then we don't know the cover is good because recharge. So if I don't see a patient very systematic, very intellectual developed, and very smart, I don't give them rechargeable, because it's going to be other problems, other variables in my assessment in terms of pain response. And actually, I had a lot of patients that had a rechargeable and came to me when they get to an implant, can I have a non-rechargeable? So they really didn't like it, the obligation to have rechargeable. Other things like have young patients, very young, I don't like to do rechargeable. I don't want to give them another thing to think about it like they are sick. I want them to forget about their illness and try to live a normal life. So I have to be dependent on, okay, everywhere that I go, I have to be recharging my battery. I think psychologically it's not positive for them. So there's a lot of things you make decision upon your own, your own bias. I hated to charge anything. So I myself don't like charging my cell phone, let alone a battery. So those are the things you take into consideration. So that company, the Bionics, do not have rechargeable. They have less leads, less options of leads. I like a very thin lead that ANS has for peripheral, so I use peripheral stimulator more ANS. So, but this depends. But it's hard for any doctor. The truth is we cannot say that one is better than the other. It's like buying a TV. So technology is there, available for everybody, and it's very hard. Sometimes you buy one here just because it's closer to you and the delivery system will be better. The financial will be better. You know what I'm saying? The logistics, the practicality of life. But medically, nobody can say one is better than the other. Any other questions? Okay, so in summary, I want to tell you guys that's really the future of the pain management is stimulation. Neuromodulation generated by stimulation. The last meeting there was for neuromodulation in Las Vegas, there was amazing. All these studies is going on now with stimulation and so many different aspects that we never even thought about it. Gastric reflux, gastroparesis, bronchospasms, and so on. There's really a lot. So our body really works around electricity. Everything is electricity. Everything is changing in potentials from here to there. So, and there is no, all of that we can see, the dorsal column stimulated, there is no side effects. Nobody gets drowsy, nobody gets dizzy, nobody gets tired, nobody gets anything. We don't see side effects with the stimulation. And that would be great, because our meds, all of them have side effects. I keep telling my patients, there's no magic bullet. All of them do bring you some side effects. You just have to know how much you're going to tolerate them in comparison to your pain level and see why your net is positive. But in truth is, you're not going to get a medication that's going to give you only pain relief and that's it. So even though the opioids, we know that doesn't give you long-term damage to your body, but every single day of your life, you're losing some part of your life by not being completely alert, not being completely fully intellectual sharp, so all those things you're losing a little bit here and there. So we know that our tools of work are not the ideal. I tell the patient, like here, I'm working with non-ideal situation. I'm trying to work what is so bad that I have to do something about it. But truly, it's not what we want to do. So we can find something that can bring our patient to a condition the pain is going to control, but they still have the mental status and have the mental toxicity, all those medications in their system, definitely it will be a very, very beautiful dream. And I think that in the next 100 years, that's where we're going to be moving towards. Mostly electrical fields and other treatments based on that. And probably we're not going to even have to implant anything. I don't know. It's going to be so sophisticated that we can probably do with minimal invasive. Maybe a little chip like this we're going to put in there. So a little incision and just chopping something there. But I'll leave this for my kids and for their generation. I wouldn't be there yet any longer. But definitely that's what we have. I think, unfortunately, we're still thinking very little about this. It's much easier to write down a prescription, send the patient out of your room. A lot of doctors who doesn't do this, doesn't want to give the patient the option to see another doctor. It's easy for them to control there. But it's soon, slowly, we're going to be talking more about it, and patients are going to know their options. And I think that definitely is going to be our future. Thank you very much.